Hi everyone, welcome to week 1 of your Pharmacy Career Planning 2 course. My name is Sarah Davis and I will be your instructor for the next 10 weeks. This course is typically taught in conjunction with Pharmacy Career Planning 1, so you're using the same textbook. In the other course, you're covering chapters 1 through 8, and in this course, you're going to be starting with chapter 9 and going through the remainder of the book. So basically, in these two courses, what we're doing is we're looking at all of the different types of pharmacy positions that are out there and how those different career paths look, what are some of the skills that are necessary, and things like that. So each week we'll be looking at a new type of system, a new type of job, and so I encourage you to kind of keep an open mind. Back in the day, as they say, retail pharmacy, hospital pharmacy, those were really the two main types of pharmacy when people thought about working as a pharmacy technician or a pharmacist. And nowadays, things are changed quite a bit. So you're going to see opportunities all over the place in a lot of different areas. So the first opportunity that we're going to be looking at this week is mail order pharmacy. Now, if any of you are from the St. Louis area, you are probably very familiar with at least one, if not two, mail order pharmacies that we have in the area. One of the smaller ones is LDI. LDI is a mail order pharmacy, and probably the largest one that you're familiar with is Express Scripts. So both of those function as mail order pharmacies. LDI actually has a retail component as well. But mail order pharmacy is a pharmacy that's going to dispense maintenance medications. So those are the things that you're going to take for things like blood pressure, maybe a thyroid condition, depression, those types of things. Those are the kinds of medications they're going to be dispensing. So something that you're taking on a regular basis are going to be processed through a mail order pharmacy. They are not intended to be able to provide any of those things that retail pharmacies do, like your antibiotics, maybe a pain reliever that you get when you are discharged from the hospital, from the ER or something like that. So totally different type of focus when we're thinking about mail order pharmacy. There is an extremely high volume that comes from a mail order pharmacy. They have been around for years and years and years. There's not been nearly as big of a push to use mail order pharmacy as there has been now. But most of the time you'll find that employers offer some sort of a benefit to their employees for using mail order versus a retail pharmacy for those maintenance medications. Maybe it's a lower copay if you go through them and things like that. So there is obviously advantages. So cost savings is a big one. Patient convenience, you can come home and it's in your mailbox ready to go. You can have access to a pharmacist at any time. So, when you go into a retail setting, obviously you can go and talk to the pharmacist as well. But in this setting, you can pick up the phone and do it. So you don't necessarily have to be face to face with them. But you can still have that relationship. Improved compliance means that we are more likely to get our patients to take their medicine like they're supposed to. So let me just give you an example. If I'm having my medications auto shipped to me every month or every 3 months, I'm less likely to forget to order a refill and to go pick it up. So if it's coming and it's in my mailbox, I'm taking it, right? But if I have to remember to go to the pharmacy and pick it up and all of that, there's more chance for me not to take the medication. Also, there's obviously, pharmacy efficiency. There's a lot of automation involved in mail order pharmacy. If you've not ever been to one of these pharmacies, I would encourage you, if you're in the area of St. Louis, to contact Express Scripts, because it really is an amazing operation to go in and see all the automation that's involved. And because there is so much automation, it does help decrease some of the dispensing errors. Obviously, there's a lot more privacy involved in mail order, and you don't have to worry about things being out of stock when you're doing things through a mail order pharmacy. But of course, there are always downsides. So things like lack of personal contact. Some people just like to have that face-to-face interaction. I know when I was working in retail in the area that I live in, we had some people that, even though we would say, well, we can make it so, Mrs. Jones, you don't have to come in every week to get a prescription. We can get them so that you're picking them up all at the same time. You only have to come in once a month, Oh, no, that's okay. She liked that. She liked our interaction. So that was one of the big things, that she wanted that personal contact. And some of those older people do prefer that. Medication waste is also a disadvantage if an order is DC'd or discontinued by a doctor and you've already got the 3-month supply at home. Obviously you're going to be, what are you going to do with that? You have to dispose of that. And then of course time delays. So if, for whatever reason you're not getting auto refills and you need something sooner, you have to wait for that to be dispensed and sent. So there's a lot of other elements involved in mail order pharmacy. I would like for you to make sure that you read through everything, as far as especially the different things that you can do as far as your specific work areas in a mail order pharmacy. Obviously, there's going to be places for you to work to mail things out, right? But there's all kinds of other options for you within a mail order pharmacy. Everything from filling and dispensing to maybe being that person on the phone, right? Customer service type of thing. Not a lot of face-to-face contact with people, obviously, other than your coworkers, but some people might prefer that. So take a look at some of the things in this chapter. As you're working through this chapter, if you have any questions or problems, please make sure that you reach out to me. Have a great week.